The pelvic floor is a network of muscles that connects the pubic bone, tailbone, and hip joints. It's essentially a hammock. The pelvic muscles also work in coordination to allow for urination, defecation, and sexual function. All of these which involve relaxation of the muscles. Pelvic floor laxity is the decrease in tone or strength of the pelvic floor muscles. This frequently leads to conditions like urinary incontinence or pelvic organ prolapse. Conversely, pelvic floor hypertonicity, or an increase in tone of the pelvic floor, can also lead to pelvic dysfunction. This typically manifests as an inability for these muscles to relax. It can be difficult to diagnose a patient with pelvic floor hypertonicity because patients can present with a variety of symptoms, including pelvic pain, frequent urgent need to urinate, urinary incontinence, and even painful intercourse. There are several mechanisms that can be responsible for pelvic floor dysfunction, pelvic floor hypertonicity. The primary mechanism is what we call deferred voiding, where you see a bathroom, you don't want to go. It can be something that you have, that you've kind of always had, you were a delayed voider, or it's something that you've developed secondary to social norms. I don't want to use this bathroom. You only want to use your own bathroom. Through those mechanisms or behaviors, you've given your brain an improper signal. You've increased the muscle tone and causes a sustained tone that is technically not normal. Another mechanism of developing pelvic floor hypertonicity is secondary to pain. Women with recurrent painful UTIs, vestibulitis, vulvodynia, have a normal response where muscles contract secondary to pain. Think if it hurts to do, you don't want to do it. Conditions like fibromyalgia and interstitial cystitis are also associated with a high incidence of pelvic floor hypertonicity. Trauma, surgery, and even delivery can lead to pelvic floor hypertonicity. Scarring causes a response in the pelvic muscles of contraction. This contraction essentially leads to increase in tone. Stress and anxiety can also cause an increase in pelvic floor tone. There is not a direct mechanism neurologically that associates the two, but in the caveman era, the stress response was to protect your vital organs. The primitive self is that you have a tilt of your tailbone or a contraction, which is a shortening of those muscles. So with a normal stress response, like a subconscious stress response, it would be appropriate to have a contraction for a protection mechanism. But in 2021, that protection mechanism is not necessary. But still with stress, you have this associated contraction, or you can get an associated contraction or stress response. Pelvic floor hypertonicity can have a wide variety of effects. It can cause difficulty urinating, even complete urinary retention. It can cause urinary incontinence because muscles lack the ability to contract any further. It can lead to constipation and painful intercourse. Even with 10% contraction of the pelvic floor muscles, you see a 50% reduction in blood and oxygen flow. This leads to inflammation and pain. Pelvic floor hypertonicity can be diagnosed with a good history and physical exam. Therapies for pelvic floor hypertonicity include behavioral changes, physical therapy with a specialized pelvic floor physical therapist, muscle relaxers, vaginal suppositories, trigger point injections, and Botox. If you feel you have signs and symptoms of pelvic floor hypertonicity, it's important to seek the care of a specialist.